Namaste and a warm welcome to all Deaf Youth to the Deaf Youth Dialogue Nepal 2.0. My name is Barsa Gurung. Today we are discussing an incredibly vital topic, the experiences of deaf youth when visiting hospitals and seeking healthcare services. Joining us to share his story is Manish ji.
Thank you, I'm so happy to be here. Sharing my story and speaking my mind openly feels wonderful. I'm very grateful for this opportunity.
To start off, what was your very first experience like when you went to a hospital?
My biggest struggle at the hospital above everything else was communication. The doctors and nurses would talk to each other, and my relatives and parents had long conversations. I could not understand a thing. Reading their gestures was hard, and that first experience was overwhelming.
Oh, it sounds incredibly tough. How did you feel at that time?
From my experience, the first time I went, I felt nervous and a little scared. I wanted to ask questions, but it was hard. I also felt frustrated because I did not fully understand the instructions. Still, I realized that the same challenges happen to other deaf people too, and there are solutions.
What challenges did you face at the hospital?
Yes, challenges are everywhere. I find it very difficult to communicate with doctors. When I use natural sign language, sometimes they understand a little and sometimes they don't understand at all. But often they are confused. My relatives or parents help me by interpreting in natural sign language. But doctors are usually very busy and speak fast. I also try writing notes, but it takes a long time. Some doctors don't want to write. They only speak. This creates a big communication barrier. For example, when I was pregnant, doctors spoke only to my parents and ignored me. They didn't pay attention even though I was the one who was pregnant. Later, parents gave me a short explanation in natural sign language with a timetable and some key points, but it was not complete. I could not fully understand what the doctor had said about my health. That made me feel left out and worried.
That must have been very hard. Based on these experiences, what have you learned?
I have experience learning in the hospital and still need guidance. Communication is difficult for me, so I use writing and natural sign language. The staff help me sometimes and try to arrange ways for me to communicate, but it is still challenging.
There are many hospitals, but if a deaf person is sick, how will they manage?
Even though hospitals are opening everywhere and claiming to be inclusive, there are still no sign language interpreters. But I truly hope that every hospital will have a dedicated interpreter. If a deaf person comes with their parents, doctors must still address the patient directly. If I am the one who is sick, ask me, talk to the deaf person directly.
For those deaf youth who might be going to a hospital for the first time, what is your advice to them?
Thank you for that question. My advice is don't be afraid to ask for help. Take your family, relatives, or loved ones with you. Write down your questions until you understand what the doctor says. Don't leave until everything is clear. Only then should you leave. It makes things easier.
Yes, that's very helpful. Before we end, do you want to share a final message?
I hope I'm not the only one facing communication barriers with doctors. I have experienced this and it is a big problem. Deaf people go to hospitals for pregnancy care, treatment after violence, and other health services. Healthcare staff need to understand how to communicate with them using natural sign language or easy to read writing or interpreter or Nepali sign language. Staff should provide interpreters or communication services so deaf people can speak directly with doctors, not just through parents. Hospitals are here to help us. Deaf youth should feel confident asking questions. Everyone deserves good health care and clear communication.
Thank you. You shared your story with such detail. To all all the viewers and deaf youth. Remember, healthcare is everyone's right, and deaf youth should have safe and accessible services when visiting a hospital.
Welcome. I just want everyone to receive good services without barriers. Barriers can be changed and solved. With interpreters or parents, access can improve everywhere. I hope this change happens soon. Let's work toward that.
Manish, thank you for the warm welcome. I would like to give you something. Guess what?
Sign up, applause.